Well, that's where I want to welcome in my next guest, clinical psychologist, Dr. Jolie Silva. Doctor, good to see you.
Thanks for having me.
All right, so these are tragic stories, and I've had you on the show before. You worked extensively with the court system, the criminal justice system, but with children as well, a whole other side of your practice for many, many years, school psychology, clinical forensic psychologist. You're probably nobody better than you to bring on for this topic. So first, what signs should parents be looking for if your child was part of a massive traumatic event, a school shooting, fire in a building, something of that nature, a natural disaster? What should parents be looking for in their kids to ensure they're not suffering from survivor's guilt, or if they are, to get ahead of it?
Well, going through such a traumatic event like that, a large portion of those children probably have post-traumatic stress disorder. And some things parents can look at to see if their children are suffering from this would be isolation. Isolation has been found to be one of the major risk factors in committing suicide. Isolation meaning staying by yourself, more withdrawn behaviors, which is common for adolescents anyway. Adolescents tend to stay by themselves in the house and aren't so engaged in their families. They're more engaged with peers. But if they see a change in socialization, increased isolation, problems with sleep, problems with appetite, and more sadness, those would all be indicators of post-traumatic stress disorder, in addition to heightened anxiety, heightened startle response, not wanting to return to the place where the traumatic event happened or any other place that resembles where the traumatic event happened. And with survivor's guilt, it's these beliefs that, could I have done something differently? Why me? What was my responsibility in this? Another thing about adolescence and depression is that one of the major symptoms is irritability. And I think a lot of people don't realize that when we talk about depression. With adults, you see more of a depressed mood, but when you're talking about children and adolescents, one of the major symptoms is irritability. So a lot of passion. So any questions about it, they should talk to the schools, talk to a mental health provider to further assess it.
Now, are the symptoms the same for an adult? And in the Sandy Hook case, it was a 49-year-old dad of one of the victims who took his own life. Would you be looking for the same indicators in an adult?
Pretty much, yes. I mean, you would still be looking for the social isolation. You would still be looking for a depressed mood, not wanting to engage in activities that you used to engage in. It's something called anhedonia, where it's this inability to experience pleasure the way that you used to. So all of those things would be indicators. And again, 60% of people who commit suicide have not been diagnosed with a mental health disorder. It doesn't mean they didn't have one. It means they haven't been diagnosed with one, meaning they did not seek proper treatment in order to receive that diagnosis. So really, it's the people closest, family, teachers, coworkers, who would notice these signs the most. And there is always the suicide prevention lifeline that people can call. It's 24 hours a day. If you think anyone in your family or friends might be at risk for suicide, or if you yourself feel as though you might be at risk for suicide.
All right, so that's great advice. So what do? You're a parent, and you notice that your kid is normally not the most social with your family, but now they're not seeing their friends. They're depressed. They used to like to play video games. They're not playing their video games. What do?
I would say, first thing is to talk to the child in a validating way, meaning present questions to the child where you're acknowledging their feelings, because adolescents tend to be defensive, especially with their parents. So you really want to get in there and ask questions in a validating way. Like, it seems like you're sad. Do you feel sad? And then you can always ask the questions. Have you ever thought about hurting yourself? Have you ever thought about killing yourself? Just to open the conversation. It's a conversation that needs to be open and discussed. And then encouraging them to seek mental health treatment. Just because they don't want to talk to their parents doesn't mean they don't want to talk to a therapist. I have all kinds of clients who don't want to open up to their parents, but do open up to me because I'm neutral, I'm unbiased, I'm not going to judge. So getting them in the door of just an initial session with a mental health provider can be life-saving.
I think that is absolutely outstanding advice. And is there a general number for the suicide prevention helplines?
You know, I don't know it offhand, but it's called Suicide Prevention Lifeline. If you Google it, it'll come up right away.
Suicide Prevention Lifeline. Dr. Jolie Silva,
Yeah.
life-saving advice. Thanks very much.
Thanks for having me.